acceptable.
Yeah.
Oh, yes, it's being live streamed. Okay. Did we have a lot of schools sign up for this one, Jennifer?
They don't necessarily sign up, but Joan did send out a nice reminder.
Okay,
We're live.
great. So Jen, just so that you are aware, so Jen, I am getting, just so that you are aware, so Jen, I am getting, just so that you are
I'm hearing
aware.
that as well.
So Jen,
Okay, good.
I am getting, just so that you
I'm
Gavin, are
hearing
you
that
hearing
as
it?
well.
So Jen,
Okay, good.
I am getting, okay, because that was what I was hearing last time. That's an
Okay.
example of what it was, but it was just during the Kahoot. So everything I would say would then just start
Echoing.
on top of each other and then on
Huh.
top of each other.
Yeah, I had an interesting little weird remix vibe to it.
It did, didn't like we just needed a beat to drop.
Yes, that would have been okay. This works. Okay, this works.
I did actually send out a reminder to all the schools, so I'm hoping that students will participate this morning. Thank you.
Great. Great. Okay, let's see.
So far, so good.
Yeah, no feedback. All right, that's a good thing.
Test.
Yeah,
No feedback.
I'm not hearing a loop.
That's wonderful. So anybody that tuned in and listened to us trying to get this settled, we apologize. And I think we'll get going here in a couple of seconds.
Sounds good.
So whenever you're ready, Devana.
Okay.
So whenever you're ready, Devana.
There's the loop.
Okay.
So
There's
whenever
the loop.
you're ready, Devana.
There's the loop.
Okay.
So
There's the
whenever
loop.
you're ready, Devana.
There's the loop.
Okay.
So
There's the
whenever
loop.
you're ready, Devana.
There's the loop.
Okay.
So
There's the
whenever
loop.
you're ready, Devana.
There's the loop.
Okay.
So
There's the
whenever
loop.
you're ready, Devana.
There's the loop.
Okay.
So
There's the
whenever
loop.
you're ready, Devana.
There's the loop.
Okay.
So
There's the
whenever
loop.
you're ready, Devana. You're hearing
There's
a
the
loop.
loop.
Okay.
So
There's
are
the
you
loop.
hearing music? You're hearing a
There's the
loop.
loop.
Okay.
So
There's
are
the
you
loop.
hearing music? You're hearing a
There's the
loop.
loop.
Okay.
So
There's
are
the
you
loop.
hearing music? You're hearing a
There's the
loop.
loop.
Okay.
Music.
There's
Are
the
you
loop.
hearing music?
There's
You're
the
hearing a
loop.
loop.
Okay.
Music.
There's
Are
the
you
loop.
hearing music? You're hearing a
There's the
loop.
loop.
Okay.
Music.
There's
Are
the
you
loop.
hearing music? You're hearing a
There's the
loop.
loop.
Okay.
Music.
There's
Are
the
you
loop.
hearing music? You're hearing a loop.
Okay.
Music.
There's
Are
the
you
loop.
hearing music? You're hearing a loop.
Okay.
Music.
There's
Are
the
you
loop.
hearing music? You're hearing a loop.
Okay.
Now it's gone.
Hmm. I mean, my take is that that's too clean of a repeat for it to be something coming through speakers and microphone. It's got to be something in software.
Well, it only occurs while I'm sharing my screen, so we can proceed without me doing that. We might have to skip the Kahoot this time.
Okay. All right, then I will get started right now then. Welcome everyone to today's Center for Healthcare Careers of Southeastern Wisconsin's Meet the Healthcare Professional presentation. I do apologize if you've been hearing some of our technical difficulties. We were creating our own kind of music and it wasn't as beautiful as we wanted it to be. But my name is Devonna Williamson and I am a talent business partner with Freighter Health and I will be your host today. Today's presentation is sponsored by Advocate Aurora, Ascension, Children's Wisconsin, and Freighter Health. A few housekeeping items. We are hoping to maybe have a activity, but it may cause looping, so we may not do that. If we do decide to go that direction, you will want your cell phones available, and you would go to www.kahoot.it. Maybe we can try it and see if it loops, and if it does, go away from it. But that would be for later on in the presentation. If you have any questions, we do hope that you will enter them into the chat box, and then I will be able to ask those questions of our speakers as we get to an opportunity to do that. Today's topic is going to be radiology, and we are lucky enough to have Gavin Rice with us, and we will hopefully also have Kerry Larson-Berryhill from Ascension, and they will be chatting with us to share their knowledge of the radiology field. Gavin, since you're there and we're, hoping that Kerry can join us, I'll let you start with yourself and introduce and tell us a little bit about yourself.
Sure. Thanks, Dawn. My name is Gavin. I'm a sonographer. So another term for that would be an ultrasound tech. I work at St. Francis Hospital, and I've been doing this for about 17 years now, kind of throughout different Milwaukee hospitals and that. So.
Great. Wonderful. Some of the words and terms we're going to be using today, you said sonographer, ultrasound tech. We have this titled as I think radiology, and then also imaging. I think imaging is probably the overarching title for those roles in general.
Exactly. Yeah.
Okay. Great. Wonderful. So as a sonographer, what do you do on a day-to-day basis?
Sure. I work in general ultrasound. So by general, I mean, we kind of look at everything. There are more specific ultrasound departments, sometimes at some hospitals where they only look at stuff with blood vessels. There's another field very closely related that looks only at the heart. But in general ultrasound, we look at kind of everything. So basically all people's internal organs, people's livers and spleens and kidneys and gallbladders. We look at arteries and veins, your thyroid gland right at the base of your neck, all kinds of stuff.
So I will say that when I think of sonography and then I think of the word ultrasound, I think of pregnancy. Everyone thinks about the ultrasound pictures. Is that something that you do and falls into your world? Yeah.
In this ultrasound department and at a lot of general ultrasound departments, we do some of the baby stuff. Sometimes there are more specific ultrasound departments that handle only baby stuff. So for people in my profession that really like that part of the job, there are ways where they can go and just do that. For those of us that like a little bit more variety in what they do, we do some of the early pregnancy stuff and then some more basic pregnancy exams. And that's maybe 5 or 10% of the job is the pregnancy stuff. All the other stuff, all the organs I just mentioned a second ago, that's like the other 90% of the job. It's just that most people aren't really aware of it. So.
Yeah, that's really cool that, it's interesting that small part of your field is what everyone associates with you, but you're saying there's so much more to what sonography does. Very cool. So what drew you to this field? What made you decide, I want to go and take pictures of organs and stuff? Yeah.
Well, because things like this didn't exist when I was in high school to help me even know that this was a thing. I ended up kind of falling into it. I took a long path. I went into engineering school and then into radiography, which is X-ray, CT, all that stuff. And then while I was in that, they said, hey, are you interested in ultrasound? And then I went back to school yet again for ultrasound. And this is Kerry, my boss, that just scooted in back here.
Hello. So go ahead.
Okay.
No, I was just going to say, so, having introduced yourself and said that you're a sonographer, obviously Kerry is your boss, you said, but Kerry, what is your background in imaging?
So my background is X-ray. I've been a tech now for about 17 years. I'll take my mask off. I started in just general X-ray, and then I moved up a little bit, worked in the OR, did pain management. We do GI procedures. Then became a lead for a smaller OR department at one of our sister sites at Franklin, and then came back here to be a manager. So I'm over 8 departments right now, but everything from X-ray, mammo, ultrasound, MRI, CT, IR, nuke med.
Thank you for calling US Cellular. Para
I'm sorry?
español, diga español.
I can't hear that.
No, that wasn't her. That was the noise in the background.
Oh,
Yeah.
okay. I'm just going to turn the speaker up a little bit.
Okay, perfect.
I'm a little hard of hearing, sorry.
No. Well, thank you for sharing that. You read off a lot of initials there. So can we start with just focusing in on the difference between sonography and, like, say, an X-ray tech or a rad tech? Because I know those are comparable terms there. Can you maybe share what the difference is between those two?
Sure. So I'll let him explain the sonography part, but I'll just kind of break down X-ray a little bit. So most people kind of start in general radiography, but then you can branch off. So from X-ray, you can go to CT, which is CAT scan. You can go to MRI, which is magnetic resonance imaging. You can go to IR, which is interventional radiology. You can also go to mammography. Obviously, that's breast imaging. And then some X-ray people do branch off into sonography. It's not the most common thing. You can go right into sonography rather than going into X-ray. It just depends what people choose to do. So that's kind of a one-off. And then nuclear medicine is also, most people don't start in X-ray either. Usually they just go right into nuclear medicine. That's a 4-year program. And there's only a few schools in the state that offer that program. But one of our nuke med techs was an X-ray tech before he became a nuke med tech. So it just depends on what you want to do with yourself. But then, so obviously X-ray, we use radiation imaging. Now, when you go on the CT and mammography, we continue to use those in nuke med and IR. Now, MRI is different. We use radio waves and magnets for that imaging. So that is not radiation. And over the course of years, with medical advancement, we've definitely found ways to decrease the dosage that we're giving to patients. So, obviously the benefits outweigh the risks for anything like that. But I'll let Galen explain the sonography part of it, just because that's his specialty.
Great, wonderful. Thank you so much. And then Gavin, you were going to talk about sonography?
Sure. Yeah, what Kerry was kind of getting at is that all the different areas of imaging are using different ways to look into the body. So X-ray uses radiation, MRI uses magnetic fields, ultrasound uses sound waves, really high frequency sound waves. They go into the body, they reflect off the stuff inside, they bounce back, and then computers are putting that together 10, 20,000 times a second into a picture. And that's all real time so that we can see what's going on inside the body and use that to help figure out whatever it is we're trying to figure out.
Is it fair to say that X-ray focuses in more on the bones for the pictures that it creates?
That's pretty reasonable. X-ray works kind of like a camera. So a normal camera that you use uses light to see kind of what's there, and it makes shadows around things that are blocking the light. With X-ray, it's doing that, but with radiation. So because the bones are really dense, the X-ray can't pass through them. So it makes a shadow of them on the film. And
Perfect.
that is the X-ray. And then you're just seeing the flip to that. So everything that would be dark like a shadow is bright.
Great, wonderful, thank you. As a reminder for those who are listening, you can definitely type in questions into the chat if you have questions for us, or you can text a question to 262-488-2795. Thank you so much. And on to the next question. So we talked about people going into your field and they could go left or right or take all these different paths, but what sort of training or education is necessary to take maybe that more common path of getting to be an X-ray tech, a rad tech, versus maybe the path to being a sonographer? What sort of education do you guys need?
You want to take the
Sure. So there's different, you can get an associate's degree in radiology, you can get a bachelor's degree in radiology. It depends on what school you go through. I know MATC offers an associate's degree. And then we have other affiliations like our St. Joe's site, and their campus has their own school, which is affiliated with UWM. And so then they get a bachelor's degree. So it just depends on how long. Usually there are prerequisites involved, and it depends how long how much time you have to give to those prerequisites, but usually about 2 years. You're going to take your basic like anatomy and stuff like that. What's the other one? Medical terminology. There's just so many different, so when you get into the field, they expect you to know different phrases. So when they give a diagnosis, what they're looking for, what they think that the problem is. So those are all part of the learning. So you go through that and you get your prerequisites, and then you apply to a program for radiology or sonography. And then, so NUCMED, I'm not sure what the prerequisites for that program are, but that is a bachelor's degree, so it might be all encompassing. And then trying to think what else. I think that's pretty much it. I mean, and then usually once you start your associate's or bachelor's degree, it's anywhere from 2 years, obviously, to 4 years, depending on what program you pick. And we had stopped doing internships for a long time, but we just recently have started them back up. So the one thing with healthcare, it changes so drastically that, we definitely need people in every aspect of our technology and, every modality that we serve. So, but yeah.
Great. Wonderful. Thank you. So a question did come in, and I think you started to actually address it when you were chatting. But so you're saying some of the basic classes that you would take in college that are tied into your field, is that medical terminology?
Yes.
And then I think you said anatomy.
Yep. Biology. So just different, and even just general math. I think there was some English. It's been so long, sorry. So, but just think of, some of your basics to kind of platform you off into a field. Most, you have to take general studies in most any degree seeking, programs. So, but for a medical diploma, you need a lot more medical background. So yeah, like the medical terminology, biology,
Anatomy.
and then what was the other one I said?
Anatomy.
Anatomy.
Oh yeah,
Yeah.
Yep, anatomy. So just that kind of stuff.
Great.
The thing with the math is once you get into X-ray, physics plays a big part of it. So that's something that I didn't realize till I got into the program, and then it was like physics. So I'm not a big math person, but a lot of times you have good teachers that can get you where you need to be. So
Perfect. Thank you. So when you think you're touching on what kind of the next question was, which is when you think about being in your career, what sort of skills, what sort of abilities make someone successful in your field?
So I would say the number one, and I tried to teach this when I was a lead teaching people in the OR, is communication. If we don't have communication, we don't have anything. There's a huge breakdown. Whether it's once you get into healthcare, whether it's with the physicians, whether it's with staff, whether if it's with your manager, nurses on the floor, or just nurses in general in our department, our needs, our abilities. Sometimes it's education, and all of that comes from right back to communication. You know, when I was in the OR, the one thing I taught them is that, you know, your introduction, that says a lot. You go in, you introduce yourself. Hey, I'm Kerry. Nice to meet you. We haven't worked together before. Tell me what you like, what it is that you're looking for. What can I do for you? That goes a long way, and it speaks volumes. I always found that physicians respected you if you could have an open conversation with them. So I think that's first and foremost. And, you know, if I don't communicate with my staff, they don't know what's going on in the hospital. If I don't disseminate that communication, if I don't walk around and talk to them, you know, so communication is a big key to every day. And then from there, you know, obviously it's, you know, like I said, introduction, just knowing how to stay calm and deal with situations. But it just starts with communication. So.
Perfect. No, that's great. Gavin, do you think that there are any specific skills or abilities someone needs to have to be successful?
Yes, there are, in all the different imaging fields, especially in ultrasound, but it applies to X-ray as well. When you're taking pictures of something you can't see, if you could see it, you wouldn't need us. An ability to visualize what you might be looking at, something that you develop either through school and practice. Some people have a little bit of an innate ability to do this pretty well, but you'll learn it too, is taking an object that you can't see and picturing the sides of it that you can't see. Kind of a three-dimensional spatial awareness kind of thing. It's kind of more of a technical skill thing, but yeah, it's basically that anatomy that you learn that's in a flat textbook, being able to picture that kind of fleshed out in your head. That's a skill that you learn. That's kind of cool.
So that's pretty amazing that you say that. I now know I would completely fail at this career. My depth perception and my spatial awareness, I run into things not on the street, but like in my house all the time. So no, thank you. Yes, that's really helpful. When you touched on this a little bit when you were chatting, what suggestions would you give to a young person who is considering this as a career, like someone who's in high school who hasn't yet picked college classes yet?
Oh, the one kind of cool thing that's been long standing in our fields since before I started school is job shadowing. So I'd recommend anybody who thinks they might like some of this, contact wherever your local hospital is, talk to usually whoever the director of radiology is, or Kerry's equivalent, and tell them you want a job shadow. And for 4 hours, 8 hours, whatever you can, I mean, COVID restrictions and all that stuff aside, you can come and hang out with us for a day and see what we do, because that's actually, in a lot of programs, that's a requirement before you can even apply.
Oh, very cool.
So
very cool. Great. Wonderful. So I'm going to ask each of you to tell me what you like most about your job. And since your mask is off, Gavin, we'll start with you.
Sure. There's a lot of variety in what we do, but I think my favorite part is kind of the detective work. Sometimes when I'm talking with my patients about what we're doing, I describe my job as I'm the detective, the radiologist is the doctor I work with, they're the judge. So it's my job to gather all the evidence that we need to prove what is or isn't going on. And that's kind of a careful, thoughtful process. And to do it well, there's a lot of nuance to it. It's kind of cool. And yeah, every case is a little bit of that. You never know what you're going to come up against because everybody's a little bit different. And that keeps it really interesting.
Perfect. Wonderful. Kerry, is there something that you enjoy most about what you do?
So I just think as my career advanced, the biggest part is the patient care. I think people don't realize how much radiology plays a part in patient care every day. A lot of focus is on nursing and that, but there's so many other areas that contribute to patient care. So we are a big part of the ED. We are a big part of inpatient care. We're a big part of outpatient care. Your patients wouldn't be able to go to the OR without us. And we don't have patients all day, not for 8 hours or 12 hours. We're a brief moment in time for them. But again, how we communicate with them is everlasting. Like if we are great to them, then they, respond to that. They remember that. When you come in, a motorcycle accident, we're the ones that are going to take pictures of your fractured bones, or we're gonna, ultrasound your liver, or, if there's any, it just depends what the need is. And, without us, you're not going to get from point A to point C. So we have to be there, and that patient care is valuable. And, just knowing, you have so many patients that come in, they don't know what maybe their CT has in store for them, what that's going to mean for them at the end of the day. Or if you have a patient with a breast lump, what does that mean for them? And we have to be, sympathetic to that type of care. So, it's just, I think patient care is the biggest thing. When I worked in the OR, we were the ones imaging, if it was a fractured hip or a collapsed vertebrae. We help those doctors see those body parts in real time, like Gavin said, so they can repair those. And so patients can, heal. And so that's just a big part of it, I think.
So I, of course, have to ask the opposite question. It's not all rosy and sunshiny. If those are your favorite things, the patient interaction and care, and knowing you're supporting them, and, I forgot what you said you really liked about it, Gavin, the detective work, there we go. What aspect of your job, Kerry, do you find the most challenging or the least enjoyable aspect of it?
Sometimes patients can be the same. You might have a patient that comes in that is angry, and you have to deal with that. But how we talk to them and how we communicate and our understanding of that, and just kind of digging in a little bit to their patient chart to see what they're going through. Maybe they were delayed for some reason, or maybe they showed up at the wrong site. You know what I mean? We have patients that sometimes show up here and we're supposed to be done at Franklin, and sometimes we're already busy, but so we somehow manage that and we work through that so we can accommodate that. But the patients aren't always happy because now they might have to wait, but or whatever it is they're going through personally, that inner struggle that they have. Sometimes it's just that, or they're, like you said, or like I was saying, like you come in from an accident or something, they're in pain. So we also have to be, sympathetic of that. So there's, you can have different spectrums with the patient care, but at the end of it, I think we try to make the most positive situation for them. I don't know if that's the same for Gavin, but.
So Gavin, what about you? What do you find to be the least exciting, enjoyable part of your job?
Well, I have two advantages when it comes to patient care stuff that Kerry doesn't get to have, because my ultrasound exams tend to be shortish, anywhere from 15 minutes to an hour. And then even if that's a rough patient to work with for whatever reason, I get to move on to another patient. And if it's not, things go really badly, they get to talk to Kerry. I get to pawn them off on her. So I have those advantages. The hardest thing I think in ultrasound and in a lot of medical imaging fields is part of the variety of, you never know what you're going to face every day, is that it can get really busy. So sometimes you run into spots where, things get stressful because it gets busy. And the other thing that can be difficult is some of these jobs can be physically demanding. Ultrasound can be really hard on your shoulder, on your elbows. Moving patients back and forth with MRI and CT, and that can be hard on you as well. So there's some physical challenges sometimes.
Okay.
And then just kind of maintaining good mental focus throughout the whole day in order to do your job well can be a challenge sometimes.
Okay, great. Wonderful. Yeah, I think people don't remember that in healthcare, how focused you are on the patient, even when it's not a doctor or a nurse. That's a typical focus that you guys have to deal with the patients day in and day out. And they're not coming to you because they're excited or without fear or trepidation. You know, even the ultrasound for pregnancy that we were talking about, people are excited, but they're also like, when they're coming in for that. So it's important to remember. As a quick reminder, again, if you do have any questions, please feel free to enter them into the chat or text 262-488-2795. Thank you so much. Now, I know one of the things that you mentioned or you alluded to, Kerry, and I'm assuming it's the same for you, Gavin. What settings do your imaging people work in? Is it only hospitals?
No, depending on the imaging modality, there are clinics that have X-ray. Most clinics don't have CT and MRI because those are bigger, more expensive things. Ultrasound, there are clinics that have it, hospitals that have it. You can even work as a traveler kind of thing too. It's clinics and hospitals for really all of it.
Okay, great. And then you also were talking about the doctors, and I'm going to ask this question. We talked X-ray tech, and that's same thing as a rad tech, and then radiologist.
Mm-hmm.
So can you talk about what the difference between that is? And then as a follow-up to that, are radiologists the only kind of doctors that you work with?
So the relationship, and it's often confused, the relationship between radiographer and radiologist. The radiographer takes the pictures. The radiologists are doctors that are specifically working with medical imaging. So all they do all day is sit in front of a computer and read, and by read, we mean put together the results from CTs, MRIs, X-rays, ultrasounds, nuclear medicine studies, all that stuff. They are the dorks of the doctors. They really are. So the relationship between us and them is that the work that we do goes to the radiologist, and it's the radiologist's results that go to the patient's doctors. The doctors that order the tests don't necessarily know how to interpret the pictures. So the radiologists are there in between.
Okay.
And I'd say radiologists have specialties too. So there's we have different MSK people, which is more body stuff.
Sure.
We have neuro, which is brain, different functions like that. We also have interventional radiologists who perform more procedural stuff. So maybe an NG tube, which is a tube that goes down your nasal passage, stuff like that. So, whether they can give you something dietary or whatever, like liquid form. There's so many different things. If you have a blood clot, there's neuro radiologists that remove blood clots. So there's just so many different facets of a radiologist. And an MSK guy does not perform a procedure, or a neuro guy probably doesn't do MSK or maybe specializes in both. We also have mammal radiologists who are specific for breast imaging. So they all have their specialty and their go-to. and they're all great for different things. You know, we have a great group here. So we attached to our facility, we have a neural facility. So we do a lot of MRI, brain imaging, cervical spine, T-spine, thoracic spine, and lumbar spine imaging for MS patients, for Alzheimer's. So there's so many different facets, and those radiologists kind of, so they each have their own part. So yeah, there's just so many different things that you can do with that. And there's people that work from home, remote, so they don't have to be here. There's third shifters that are remote. They don't come on site. They just read these studies. But they also have to have a quick turnover for some of these. If we have a stat, they expect those or the response time to be pretty quick. If we have a stroke, they have to read that within 30 minutes. So, you know, a lot of that patient care, the follow-up patient care is dependent on how fast we are and how fast the radiologists are in their interpretation of our imaging.
Very cool. I do know you talked about, I think you said the true nerds of the doctoring field. I do remember walking down the hallways in imaging at one of my hospitals, and the darkened rooms with just the screens up so that they can look at the pictures of whatever it is that they've been sent, you know, kind of like vampires. I'm just saying. So we do have a question that is really focused around hours. What sort of schedule, what sort of hours do our, you know, radiology, ultrasound techs, et cetera, do?
I'll let him speak for ultrasound when I'm done. So in a hospital setting, obviously most things are 24/7. So like X-ray and CT are always here in a hospital, 24/7, they're here. If a patient comes in through the ED with a stroke, we have to have somebody here for CT to be able to do a head CT or what we call a CTA to see if there is a blockage or something. So certain departments are more 24/7 than others. X-ray is also 24/7. We have a NICU here. Not all sites have a NICU, but let's say something happens to one of the babies. So we have to go up and we have to take maybe a chest X-ray or an abdomen X-ray. You know, if the baby's not holding down their food, they might want to see the stomach. So then we go take a X-ray of that. So it just depends, but X-ray and CT are on site 24/7. MRI, we usually, you know, anywhere from 7 to 5 every day. And then they take call overnight for any emergent needs. And then nuke med, the same thing. So usually like 6:30 to 4:30. And then they're on call as well. Mammos, no, they're more 8 to 5 department. They don't take call. And IR is another, usually like a 7:30 to 5 or whatever with call after. So if you're not here 24/7, you're probably a call department, except for mammography, who's not a, you know, they're not call. And then I'll let Gavin explain ultrasound.
Sure. Yeah. For ultrasound, and it's not dissimilar from some of the other departments. We keep staff in-house, meaning in the hospital, available during like your normal first shift kind of job hours. So 7 in the morning until 4 or 5 in the afternoon. And then what Kerry was mentioning, being on call, what that means is that if I'm on call, like I was this past weekend, I just have to have my phone on or near me, and at absolutely any time during that period, they can call me and say, we need you to come in for whatever. And then I have about a half an hour to be at the hospital, punched in, ready to go to help take care of whatever that is. And that could be in the middle of dinner or in the middle of sleeping, doesn't matter. And it can happen a lot. It took that, you know, how often you get called in depends on the hospital. But yeah, I mean, and if the question was more thinking about, hey, if I went into one of these jobs, what kind of hours would I work? As Kerry was saying, like a lot of the areas in medical imaging are staffed 24/7. A lot of people want that normal kind of first shift job because that's what most people like. Second and third shifts, so like middle of the afternoon until 11 p.m., 1 a.m., somewhere in there is second shift, and then third shift would be 10 or 11 p.m. until 7 a.m. roughly. Are still those are the harder to staff shifts. It's hard to find people to fill those. So when you come into a career like ours, sometimes you end up having to work second or third shift for a little while before you can kind of move down into a first shift role when they open. That's depending on the hospital or the clinic. Sometimes that's something you kind of have to deal with to kind of get into where you want to be in your career.
So with the on-call that you were referencing, you're maybe doing 40 hours a week of work, but then have a rotational couple of days a week, whatever, of on-call, and then you're off of the rotation?
Exactly, yeah. Our departments, when we've got all of our people, I'm on every fourth weekend. Right now it's every third, but yeah, exactly. So for that weekend, for that 48 hours, I'd be the one on call. And then the next couple of weekends, I'm not. It's my coworkers' turn, and we just rotate through all of that. So yeah.
Okay, great, wonderful. That's helpful. Thank you. We, talked a little bit about what a high school student might want to study in school, but while you're in college, or maybe when you're finishing up your high school classes, are there any roles or jobs that you could take that would be preparatory or lead-ins to get you ready to work alongside people like you?
I mean, anything where you're getting exposure to hospital patients, medical patients is good. So, being a CNA, something like that. There are sometimes sort of like almost office style positions in some radiology departments, working at a front desk, a registration desk kind of thing. There used to be file clerks. That's not as much of a thing anymore now that everything's digital.
Yeah.
Anything where you can get work with patients in a medical environment. Doesn't even necessarily have to be in a hospital. It could be a nursing home. Anything like that is good. That exposure to patients. That's what you need.
Okay. One more reminder before we close up. We have like one or two more questions, but if you have a question, you can enter it into the chat or text 262-488-2795. So you talked about kind of the front desk kind of roles, maybe in an imaging or clinic hospital setting. You talked about being a CNA. I think it was Kerry who had mentioned previously about being an intern. And is that something that you can do prior to starting classes, or is it something that's like, explain the intern, please?
So most interns are already in a program and they're closer to graduation. So probably within your senior year of whatever program you're in. So if you're in the sonography program, it would be in your last year. Same with X-ray, you go into an internship within your last year when you're a senior, only because you already have some of the skill level. So that's kind of what we look for. The intern, we would expect them to have some knowledge, already have some patient care, already be able to know some, for us, positioning or scanning abilities for sonography. Now for internships, most likely you're not going to be in a CT or MRI internship. It's going to be a base program. So if you're in a sonography program, you can come be a sonography intern because once you graduate, you'll be doing that. Now, X-ray, same thing, you would be an X-ray intern because then we're kind of preparing you. But usually you start in X-ray and then go to CT or MRI. So you wouldn't be an intern in any of those roles. So your basics, X-ray or sonography, and then you'd be a senior with a good knowledge base, be able to scan most likely or image independently. So those are some of the things that we would look for for an intern.
I know that you said you started in X-ray. At least I can't remember if you said you did, Gavin, but and then you've moved on to leadership. How often do X-ray students, rad tech students, become a rad tech, also get CT, also get MRI, also like add on and go to A, B, C, D different roles?
I think within the last, I'd say 5 to 10 years, a lot has changed. Some of the programs take a little longer, like we've kind of toyed with the idea of starting a smaller hospital-based sonography program. So for like different X-ray CT people, so maybe in the future that'll be developed. And then, so I'd say probably in the last couple of years, we've cross-trained quite a few people from X-ray to CT to MR to mammos. So it's definitely more prevalent than it used to be. I feel like, we've just gone through a lot of change, retirements, just the age group of the staff. So as they're retiring and maybe we're not turning out as many students, or there's just too many hospitals, and then you just don't have enough people to support every role, then we try to find who would fit best in those, just based on personality. We had cross-trained somebody into mammos. Like I said, you have to be more sympathetic. So just have to make sure you find the right type of person for each thing. Like, you don't want to go on the CT if stress is too hard on you. Like, for some people, they can't handle that. CT is a little faster pace. Their turnaround for the patients are faster. So can they get a stroke done in 10, 15 minutes? Because that's a requirement. So you just have to kind of see and kind of build on that. And that's why, like Gavin said, I think shadowing is such a big plus. So then you can get in, see what we do. Most people don't understand imaging at all. And then they think maybe we're just doing x-rays, but then when we have 8 departments that cover imaging, that all do different things, that all require different things. And for some of them, you have, when you, each imaging department, you have board certification. So if you were to cross-train into CT, you would have to take your CT boards, or if you go into MRI, you do have another board certification to take. And then with sonography, depending on what level sonographer you want to be, there's different board certification levels. So there's just so many different facets of things that we do, and people don't realize what imaging is, how many different areas are encompassed by that. Yeah.
Wonderful. Gavin, you look like you're going to say.
What Kerry was alluding to, maybe to help simplify it a little bit for someone who's looking at going into the field, is that MRI and CT are built off the base knowledge of radiography. So when you go into X-ray, you'll learn a bit about CT and MRI, and you can go into those somewhat easily. Ultrasound is its own separate thing. So it's not real common to go from X-ray into ultrasound. You'd basically have to go back to school again.
Okay, great. Wonderful. I'm going to ask, my last question is really going to be about kind of I think you were alluding to it, Kerry, but you even just touched on it maybe just a little bit. Can you just tell us what the ARRT is?
Sure. It's been a bit since I thought about the ARRT because I was a radiographer many years ago. The association? It's the American Registry of Radiologic Technologists.
Okay.
Yeah, no, that's a good question. Every different imaging field has its own organization that helps kind of define who's qualified to do it. So if you're going to be a radiographer, you need to be registered to officially do that. In ultrasound, we have one called the ARDMS, same kind of thing. I think CT and MRI have their own, or they fall under the ARRT.
There.
Okay. So yeah, those are all different organizations that basically say this person has proven that they have the skills to be able to do this job. They can do this legally.
And that's that board certification. So that's what you take your boards through. But we have, so many other governing bodies, different things that, policies, protocols, different standards that we have to live up to. Those are just simply requirements within the hospital. But yes, everybody takes their boards and you're either part of, like he said, ARDMS or ARRT, and then you go from there.
Okay, great. Wonderful. So you go to school, you get your degree, but then you have to basically get yourself on a registry or one of these certification sites that says, not only do you have your degree, but we are signing off that you can work as
Correct.
rad tech. Okay, great. Wonderful. Well, that was the last question that I had for you. If there's anything else you'd like to share, now is a great time, but in general, I definitely wanted to thank you for presenting for us today. Anything else that you wanted to share, or?
Yeah, I'll throw in, one, thanks for doing this. Most people, when they think of a hospital, they think it's doctors and nurses. There's a lot of other people in a lot of other positions with a lot of other skill sets that can be really interesting for people that, there's just not a lot of good access to what these jobs are. And some of them are really cool, really interesting jobs that you might not expect. So yeah, it's always worth digging in and finding out what's out there.
Wonderful. Thank you. Thank you. Well, again, Kerry, Gavin, completely appreciate you taking time out of your day to, present to our students. Looks like we have 4 classes that are observing and watching this, and hopefully some of them will decide to go into, the imaging field, one of those various areas. But we really appreciate you taking your time today. Thank you so much.
Thanks for having us.
And everyone who is watching, we appreciate you coming today. Thank you, thank you, thank you. And think about imaging as a career. All right. Have a good day.
Thanks.
You too.
Bye-bye.
Do I shut it down today?